I went upstairs to take a shower, felt fine, no problems whatsoever. Took a shower, started having pains in my chest. Literally, my arms felt like they weighed 100 pounds. Felt like an elephant was sitting on my chest. Went into the kitchen, asked my wife, asked her where the aspirins were, and which I don't take medications, so she kind of looked at me a little funny, and she didn't know whether I was kidding or not, but I said, I think I'm having a heart attack.
I didn't know if he was teasing or not because he likes to tease. And so then he said, and I said, if you think you're having a heart attack, I'm calling 911.
The patient may experience chest pain, short of breath, or referred pain in their shoulder or back.
So if somebody's having a heart attack, time is tissue, essentially, meaning time is your heart. So immediate addressing of this heart attack is important. So in the emergency department setting, you'll get an EKG on arrival if you're having chest pain and have a prompt evaluation by an emergency physician. If an EKG shows a heart attack, then the cardiologist is consulted and a what's called STEMI page alert goes out, meaning the patient's having a heart attack, which alerts all the appropriate staff to get the patient to the heart cath lab to where they can actually have the procedure done to remove the blockage in their heart.
She called 911. The ambulance was there. They must have been in the neighborhood. I mean, they were there actually in 2 or 3 minutes. They prepped me, put me on the gurney, took me outside, put me in the ambulance, hooked me up to the EKG monitor, started an IV, was in contact with the hospital the whole time.
Well, the first thing I tell patients is you don't need to apologize. A lot of times patients will come into the ER and thank goodness it's not a heart attack, but they feel embarrassed, like they shouldn't have called 911. Problem is, that's not your job to tell me whether or not it's a heart attack. If you think you have signs and symptoms, I'll figure it out. But that's what we're here for. It's for you to call us and for us to get you to the hospital in time and start therapy and diagnose your problem. You shouldn't worry about if it is or is not a heart attack. If you think it is, that's good enough.
The only thing I would like the public to know is if you have an emergency like this, don't drive yourself to the hospital. Call 911, let the professionals do their job.
The number one killer of men and women is heart disease. It's not breast cancer, it's not motor vehicle accidents, it's heart disease. And it's a time-dependent diagnosis. The heart does not regenerate like skin tissue, so once you've lost heart function, it doesn't recover. So calling 911 and get an ambulance to take you to the emergency room is your best route. When I rolled into the ER, the doctors were there, ready, the nurses. It just went on like an orchestrated symphony. It was awesome.
If you're having a heart attack or symptoms that make you think you may be having a heart attack, don't wait. The heart attack's not going to wait for you. The damage is going to be ongoing. We have staff available here 24/7, 7 days a week, no matter what time it is. Come in at that moment and we'll get started on getting the artery open, and that will allow you the best possible outcome.
I put my faith in God and put my life in Blessing's hands.
Blessing saved my husband's life.
Experience the blessing difference at blessinghealth.org/heart.